Hi there, it's Dr. Barto. I wanted to share with you a common question that I get. I had a question just a little bit ago from a mom who was wondering what kind of probiotics should she give her baby or her daughter who's about 2 or 3 years old. What's going on is this child is having some difficulty eliminating her bowels. She's had a history of digestive problems when she was a baby. She had some acid reflux, and now as she's a little bit older, she's having issues evacuating appropriately. Not so much constipation, but when she does move, the bowels are very difficult. They're large and difficult to move. So she wondered what kind of probiotics would be helpful here. She's done a couple of things. She's tried to increase her water intake. She's had her baby on Miralax, stopped hurting after a while. I can do another video on that later. Tried to give her some fiber, but that's not fixing it either. So she wanted to know about probiotics. I recommended Innate Choice probiotics. They're a wide variety of different strains. Their motto is everybody, every day for life. So there's no difference between what a baby would need or what an adult would need. The thing that varies is that you're going to give the dosage based on their body size. So I explained that to her. Now, why would a child need a probiotic? Would be the next question that people would have. Well, ideally, in a perfect world, we wouldn't need probiotics. But what happened actually in this case is this child was born via C-section. So when you're born via vaginal birth, you have the opportunity to start to seed your microbiome based on your mother's microbiome. As you come through the vaginal canal, you seed your own digestive tract with probiotics. So if your child or yourself, if you were born via C-section, you actually missed that opportunity. Therefore, probiotics would be necessary. Now, infants, they can continue on receiving their daily dose of probiotics by breastfeeding. Good news, this child was breastfed, but the quality of the probiotics received via breast milk or even through vaginal delivery is really dependent on, is mom taking daily probiotics? This would be necessary because while some of the bacteria adhere to the inside of your intestinal tracts, other ones pass through. So those ones need to be supplied every day, which is why we would take a probiotic. A lot of times we overwash our food. We can't just pick it off a tree anymore. It's not safe to do that with pick it off a tree and eat your apple because it's so heavily sprayed with pesticides. We have to wash it off. Plus our food gets traveling and there can be a lot of unfavorable bacteria on them. So we have to wash our food. On top of that, as a whole, our diet is highly, highly, highly processed. And the processed foods kill off our bacteria microbiome. So it's really necessary in this day and age that we're taking a probiotic every day. So we did recommend that for the child. I also recommended that this child get her nervous system checked. And there's 2 reasons for this. She has a history of acid reflux and a history of a C-section. And those 2 things very commonly go hand in hand. So what happens with the C-section, you can see my chart here. This is this nervous system, and you can see how the nerves go out, okay? What happens in a C-section, because of how the nature of a C-section, what happens is the baby has to be grabbed by their head and pulled out through this little tiny incision in the abdomen. And when we pull up and we create that traction from side to side, it creates a lot of damage in the upper part of the neck. Now, up in here, this is where your vagus nerve comes out of your brain and goes down. It goes straight out to your stomach. Your vagus nerve has a lot of important impacts on your entire body functioning, but it does go directly to your stomach. And this is one of the reasons why, if you've read much about probiotics, people will say about how your gut actually affects how your brain functions. And the reason that is because there's a connection between your stomach and your brain via the vagus nerve. So the health of your gut actually improves the health of your brain. And the health of your brain actually improves the health of your gut. It works both ways because of the vagus nerve. And it runs right out of here at the top of your neck. So if you experience some kind of trauma, like birth trauma because of a C-section, or birth trauma because they yanked and pulled on you with a vacuum or forceps, or just pulled on your little head anyhow just to get you out, if you experience any kind of whiplash injury in a car accident, slips and falls, you damage this upper part of your neck. It affects the vagus nerve, and it can change how your stomach functions. Now, the other aspect of it, because she's having so many problems eliminating, I would want to look at the lower back, and particularly the sacrum. What happens down here is these nerves go out to all of the organs of the abdomen. So especially all of the intestines and even reproductive organs. So with a child, what we generally see is everybody has to learn how to walk. And what happens when you walk? You fall on your butt lots and lots and lots. Even just, being a normal kid, they fall down the stairs or they bump down the stairs on their butt. And this is a strong physical stress on the sacrum and can absolutely change how the nerves are able to communicate from the brain through the elimination organs via the sacrum. And what I commonly see with problems with the sacrum is you can start to think about not just elimination problems like constipation and difficult to move bowels, but some kids wet the bed. And so I generally see once we start addressing issues in the sacrum, kids don't wet the bed as much anymore. As we grow older, I see women that have issues with menstrual difficulties, whether they don't have regular menstrual cycles or maybe they have excessive menstrual pain. Sometimes this can lead into fertility issues. So there's very many women that come into the office experiencing fertility issues. We start to improve the function of their spine, which improves the communication between the brain and the reproductive organs, and we have much better success at having babies, which is really exciting. So that's a pretty quick overview here about how the nervous system impacts your digestive organs. Not only do we need to support our digestion through proper supplementation, but we really need to support our digestive system by allowing our body to function the way that it was designed, by ensuring that our brain can communicate with every organ of your body, including your digestion, so that you can get the most out of your food. And that gives you the building blocks that your body really needs to heal and repair itself, and in the case of kids, to grow and develop optimally. So if you need to get your, if you're having a child with one of these problems, give the office a call and let's see if we can do something to help you. All right? So I'm Dr. Barto, and I will look forward to seeing you soon.